What do you feel is the biggest problem in your practice right now?
Lack of not knowing what they have to do.
That's great. That's a very honest answer. Very few people will say that. Not knowing what to do. Okay, what else? What other problems do you have?
Wasted time.
Okay. Okay, time where you should have been productive, but instead you were doing something else, or this can be like gaps in the schedule, right? Not knowing why there's so many gaps in the schedule. You're there, you could be doing dentistry, but instead you're reading a magazine. Okay, what else? What other kind of problems are you having? What is the source of the problems in your practice? What do you think it is? Take a guess.
Not enough patience.
Not enough patience? Okay, I'm going to be talking about that. I'm talking about wasted time, not knowing what to do. I'm going to hit on all those points. It doesn't matter where I am in the country, where I'm delivering this talk. Everywhere I go, I hear problems with insurance, problems with getting paid, treatment acceptance, gaps in the schedule, efficiency, hiring the right people, keeping good staff, right? Good referrals. Sometimes if you have a referral-based practice, right? What I never hear is what the real problem in the practice is. So I'll tell you what the problem is. The biggest problem in your practice is you, the doctor. You, the practice owner. That's the biggest problem. Now, let me tell you what I mean by that. I'm not saying that to pick on you. Okay? I'm saying that because you're trained in your specialty. But on the way out the door, it's almost like a cruel joke. It's like, oh, by the way, sometimes you're going to try and get an employee to do something different, and they're going to start crying. Sometimes you're going to have a morning schedule that looks good the night before, and it's going to fall apart, and no one's going to show up. And sorry, we didn't have any time to talk to you about that. Anyway, good luck. Here's your diploma. And all the other problems that come with dentistry. If I had $1 for every dentist who's told me if I could just be in the back doing my specialty, if the rest of this place could take care of itself, and I could just see one patient after another, I'd be happy. I hear that everywhere I go. But the truth is if you're going to be successful, you're going to have the rest of it well managed. Does that make sense? There's a great quote, "An expert on administration called in to straighten out or develop admin for a company can always be sure of one thing: it will be jammed at the top." So that's where you always look first. You always look at the top. You always look at the top of the organization. And the problems that you see at the top, you'll see everywhere else.